Speaking with local Illawarra resident Anna Clementi today. She has an amazing story to tell about, well, her journey, I suppose it's the only way to put it, with cancer. She was diagnosed with a form of cancer, which I'll let her explain about, way back in 1990. And here we are now in May 2012, and she's still with us today. G'day, Anna.
Oh, hi, Dave. Thanks for having me on.
In layman's terms, can you explain to us the form of cancer that you had?
I was diagnosed with non-Hodgkin's lymphoma. It's in the lymph, and I had a massive tumour in my abdominal area. It wasn't attached to any organs, but it was the size of a football when they removed it. And I've had several other lymph glands pop up in other areas, such as my neck, like a golf ball, and Gerson therapy is able to just get rid of that. Whereas I know a lot of people have surgery to have things like that done and get treated chemotherapy as well. And I know for a fact that through my own experience that the Gerson therapy just works with all of that.
I'm guessing if it's been since about 1998, that's roughly 14 years you've had experience with the Gerson therapy. Why is this treatment not well known or not mainstream?
I don't know why it's not well known. It should be well known. I'm sure they know of it. They just don't like you to know of anything else other than chemo and radiotherapy, I guess, because there's just so much to be made in the drug industry, and unfortunately, I think that's what it boils down to. This is just from my past experience with all these years and all the people that have come into contact with me through their own illnesses and searching for something other, because they certainly don't get told that there is other options that they can look at. They try and quickly get them into drastic treatments and surgeries. It does need to get out there, and people do need to be aware that there are many other options, and I'm sure Gerson therapy is not the only option. It's certainly not an easy one to take and to take on board, because it's very time consuming and it's a very, very strict therapy, and you really need to stay, particularly for the first 12 months, very close to the therapy. For me, it was, back then, it was 13 juices a day and 3 to 4 coffee enemas a day to detox the liver, and a whole cocktail of supplements, and it worked.
Go back to the start, 1990. What happened?
Back in 1990, I had 3 little girls, my youngest being only 3 months old at the time, when I found a massive lump. And, well, she was 3 months old, and I'd had my 6-week checkup, and they hadn't found anything, so they thought it was actually a cyst. But when I had my surgery, they removed a massive tumour from my abdominal area, which then followed a course of 12 months of chemotherapy. They said if you get past your 5 years, you'll be cancer free, you won't get it again. It wasn't much longer after the 5 years that it had returned. So in a space of about 10 years, I guess, I got it back 3 times. Did 2 lots of chemotherapy, and they proposed chemotherapy again with the 3rd. Lucky for me, I'd met a nurse actually that had been diagnosed with the same condition, and the treatment that I was to have was freezing of stem cell. I had to be hospitalised and in isolation in Sydney. I suppose it was fortunate for me that I'd met this lady, and she was no longer with us. I think the treatment took her out a lot quicker than the actual disease, so I opted not to go ahead and have any treatment then. And much to their shock horror that, well, you're going to die, I thought, well, somebody that I know has just died from this, so I don't think I'll be taking that road. So I knew a little bit about Gerson therapy only for some information that was given to me, and I started to pursue that. That's what led me to Dr. Max Gerson's beautiful work and absolutely amazing healings. I did Gerson therapy for approximately 2.5, almost 3 years under Catherine Alexander. I was cancer-free after that. I'd had scans and there was nothing there.
Let's just take a step back. So you've been treated with chemotherapy between 1990 and 1998, and then in 1998 you've been told, sorry, the cancer's back, there's no more we can do. Is this correct?
It wasn't that there was no more they could do. They were going to propose that they were proposing that treatment with stem cell replacement. It was like taking out some of the bone marrow stem cells. Well, I can't be exact sure of the procedure, and freezing it and then treating it and then putting it back into my body. I remember phone calls that I used to get from this lady that was having that treatment. Basically, it was pretty traumatic for her, and from our conversations on the phone while she was in isolation, not being able to see her loved ones or anything, it was pretty severe. So, no, that was a big eye-opener for me that I couldn't go down that road, and I wouldn't go down that road.
Did you know about Catherine Alexander and the Gerson therapy at this point in time, or did you think, we're going to have to do some research and find another way.
No, I didn't even know of Catherine until I was probably almost a month into the treatment. I just had some information on it, and so we Googled the rest and then started ordering the juicer and supplements and different things that go with the therapy, all being organic. And then by chance I found out that Catherine was actually based in Queensland and contacted her, and thank goodness for Catherine, because it was like my lifeline then, because it was like at least somebody knows what I'm doing and monitoring my bloods and seeing how the progression of the treatment is going. So I was very grateful that I'd found Catherine.
After being cancer-free for an extended period, you received the devastating news around 18 months ago that the cancer had returned. Tell us about this time and why you feel the cancer returned.
After being on the therapy for 2.5 to 3 years, everything was good. You slowly start to slide back into your old ways of perhaps of eating and dining out and just life itself, and who knows how it comes about in the first place. I don't know that we know that yet, be it stress, be it whatever. It came back about 1.5 years ago. I think I was in bed and I actually felt this massive lump on just underneath my heart side. I felt it and I thought, oh, this is a bit unusual. So I went and got checked out. Sure enough, the scan showed that I had a massive tumour wrapped around my aorta and pressing on my kidneys. So Catherine insisted that I'll go and see an oncologist, and my first thought was like, no, there's no way I'm going to see an oncologist, and I don't know, just seemed to get handed the right information at the right time, and I was told that haematology would be best for me because haematology works best with lymphomas and leukemias. I said that to my GP, and he said, yes, you're right there. So he sent me off to see a haematologist, and well, first of all, it was all panic buttons. No, we need to start treatment straight away. This is quite dangerous. This is not something to just leave.
Well, sorry, I just need to interrupt there. Panic buttons by the medical staff or by yourself or by both?
No, by the medical staff, not by me. I was just quite happy to start the Gerson therapy straight away and not worry about any further approval of any medical. But Catherine just insisted that I'd need to get a second opinion because she didn't quite know how much window time we had before it became a medical emergency where I might need to have surgery or something else. So I thought, okay, I'll go along to just keep you at peace, but I'm quite happy. My whole body and my mind, my heart, everything was saying, just do the Gerson therapy. So in any case, they did want to start treatment immediately, which I refused. He just looked at me and just shook his head and said, oh, I don't understand how you can just walk away and do juices and think that this is going to fix the problem. And I said, well, it actually worked for me 12 years ago, and I can't see why it won't work for me again this time, so I'm going to give it my first option. Within a period of 6 months, I actually got rid of more than 80% of this tumour that was wrapped around my aorta.
And how are you now?
I'm really good. I'm happy. I'm healthy. I haven't had recent scans yet, but I think they're due to happen in the next couple of months. Everything's going very well. I pretty much shocked the haematology department. Yeah, she wasn't sort of giving away too much information as to how good my results were until I insisted on asking her, well, can you just show me how it was and where am I at today? She had scribbled amazing on a piece of paper, but wasn't telling me that it was amazing results. And it wasn't until I had a consult with Catherine on Skype that Catherine actually, by moving her hands, said, well, just look at my hands and say that this is how big it was. Say it was the size of a ruler. It was almost down to nothing. And she said she didn't tell you how amazing that was. And I said, well, no, the only word amazing is on that piece of paper that I had to ask her to give me a copy of the blood results and things to send to you.
With your dealings with medical staff, mainstream medical practitioners and the like, I'm sure you have to go in and get blood tests, and as you said, you went back to the oncologist on Catherine's referral. What sort of attitude do they have, or how are they towards you, especially once they see the results? Are they resistant? Are they open?
No, they're not open. They've still got blinkers because it's nothing that they've actually done to help me, so therefore it it's almost like it doesn't get acknowledged. I've got a really good GP. He personally knows Catherine Alexander and has attended a couple of her doctor practitioner workshops in Wollongong, and so he knows where I'm coming from with this therapy. He wanted to understand it, and this is why he did her workshop. And so he's pretty open to what I'm doing and supportive of it, because he's seen the results not once but now twice. Yeah, so some of the reports to get back were a little bit in-your-face type things, like, don't know how Mrs. Clementi is getting these reports to be this good, but I can only think that there must be some chemo-based natural therapy supplements that she's taking. So comments kind of like this, and it's like, it's a bit ridiculous, you know. But in any case, I'm hoping that over time they come around and they start to perhaps be a little bit more involved and interested in the results, and hopefully with the next lot of scan reports and things, you know, I'm sure that they'll be just fine, that she'll come around and maybe want to know a little bit more about exactly what it is that I've done, because I'm sure that they can help so many more patients if they'd only just have a little bit of an open mind to what natural therapies can do to assist as well.
People who are listening to this interview at the moment, either they've been diagnosed with cancer or some form of chronic disease, or they have a family or friend who has been diagnosed with chronic disease or cancer. What advice would you give them?
I think the only advice I could offer them at this point would be to say, don't rush into anything out of desperation, because you don't get good results with that. You really have to do your homework and research and look at other areas outside the square, and then make the call which one feels right for you. I'm not saying Gerson therapy is the answer to all of it, but I know by not only myself but other cases it certainly has been an amazing therapy, and it doesn't just have to be a cancer. It can be lots of other chronic degenerative conditions such as diabetes, skin cancers too. There's just so much. And if you go onto Catherine Alexander's website, there's an awful lot of information there to look at.
Anna, do you mind if we give out some contact details for yourself if people would like to contact you and just have a chat and maybe get a bit of advice?
They can contact me on 42763840. Our website, www.medicinehillretreatcentre.org.au, or they can send us an email on medicinehillretreat@gmail.com. We're a registered non-profit organisation by the name of Medicine Hill Retreat Centre, and that is exactly what we aim to do. We aim to get some property to actually build a centre and be an information place for people to come along and find out about all different types of therapies that might assist them. My story is actually on our website, so they can get a bit more information on that as well.
Anna Clementi, thank you so much for your time today.
Thanks for having me on.